Hello and welcome to Navajo County Connection. I'm District 4 Supervisor Steve Williams. As an organization, the county provides a number of services to our citizens, including road repair, surveys, and so on. A lot of those projects take a lot of man hours, and so we're always looking for ways to be more efficient and to leverage technology. Here today to discuss some of those efforts on technological advances are Assistant County Manager Brian Layton and Engineering Projects Manager Jason Owens. Gentlemen, thanks for being here with us today.
Thank you.
Thank you. Before we begin to talk about technology and how the county's using technology to benefit our citizens, let's learn a little bit about the two of you. So Brian, let's start with you. How long have you been with the county and your background a little bit?
Thank you, Supervisor. We've been with the county almost 2 years now. We came from the city of San Antonio, my wife and my two children. I'm originally from Tempe, Arizona. So it's really nice to be back in the state and be a little closer to family and enjoying being in Arizona again.
Well, we're glad to have you back in Arizona, and you've been a tremendous addition to our team. So,
appreciate it.
Jason.
All right. I've been with the county for just over 4 years now. As you said, I'm one of the engineering project managers. I deal mainly with some of our in-house projects. As with many people in the county, we wear multiple hats. I also I'm part of the survey crew, so I'm able to go out and help them. I help to design a lot of our road projects and drainage projects and things like that. And recently I became a drone pilot, so under the Part 107. So we're excited about that.
You are a great asset to the county. I know that you help with you wear a number of different hats, and so we're glad to have you. So we're here today to discuss the county's implementation of technology and to help improve efficiency and safety. So Brian, why don't you talk a little bit about that?
Absolutely. And this is something that we're really excited about, Supervisor. At Navajo County, we believe that government should be innovative, it should be responsive to its citizens, and we believe that we should deliver services the most efficiently and effectively as we can. And so using technology, leveraging the technology that we have is a big part of that. And we'll learn a little bit more today about how we've been using drones, something that's relatively new, but an emerging technology that is delivering a lot of value to the county and acts as a force multiplier for staff, meaning one staff can do a lot of work, a lot more work than would be possible without this technology.
So how long has the county been using drones, and how did that come about?
It really came about over the last couple of years. I've had the chance to attend some of the survey conferences and to watch some of this technology as it's presented in those conferences. And it really caught my eye because I saw the value of what they can do as far as obtaining current aerial photos and gathering large amounts of data that is really up to date, and it just fascinated me. So we watched this technology for quite a while, but the cost of obtaining this was just out of the question for quite a while. Last year we actually had the chance to go to a survey conference, and we had the chance to win a small little drone. We brought it home and we actually put it to good use, just taking some pictures and experimenting with some of the technology. And I think it really helped to open the eyes of what possibilities or what was possible with them, and it gave us good opportunity there.
That's great. So how many drones do we currently have, and what types of projects does the county use the drones for?
Okay, so currently in Navajo County, there's two departments that have drones: the Public Works, which we have one of, which is sitting here, and the Sheriff's Department has 4 drones as well that they're putting to good use. And I think the reason behind that is in Public Works, we're able to plan our projects. You know, we typically know weeks or months ahead of time of what our projects are. Little Mormon Lake Road, I think, is a great example of how we've used it recently. And in that project, there was about 3 miles of road that we were able to map out. And speaking with one of our local engineering firms that do a great job, it was going to take them roughly about 3 days to manually survey this road. And instead, we decided to use the technology that we had We had them go out and set some control points up the road, which I think it took them just over half a day. We came in about half a day and flew the road, and then just processed that over the weekend, and it drastically reduced the time and the safety, or well, increased the safety, but it decreased the time that we spent out on the road on that project. And I think it was a great success. In addition to aerial photography, we're also able to extract three-dimensional models from the information that we gathered from the drone. So this is a project that we recently did over in Aspen Road in the Heber area. And you can see the aerial photography, but you can also see the three-dimensional aspect of the data, and it's just amazing. We can filter out the trees and other processes, but as far as the road, we're able to then pull that right into our design software, and this just saves us a huge amount of time, and we're able to pick up information that we wouldn't have been able to gather using just standard survey processes. So just another great a great opportunity to save the county time and money and resources.
Wow, that's a great example of how that technology is efficient. So are there limitations to these drones?
There are. Currently, we are operating under the FAA guidelines, which is Part 107, so I'm a remote pilot, and there are certain restrictions under those guidelines. We're supposed to, you're not supposed to fly higher than 400 feet. You're supposed to keep it within line of sight. You're not supposed to fly over people. And we try very hard to follow those rules so that we're operating in a safe and efficient manner, and also making it safe for our citizens.
That's great. So Brian, question for you. Are there, right now Public Works and the Sheriff's Office are using their drones. Are there other departments in the county that may benefit from the use of drones?
Absolutely. The use of drones in sheriff and law enforcement operations is really exciting. One is, paramount is officer safety, right? As deputies are approaching a situation where there's unknown elements, unknown entrances, exits, we can put the drone in the air, get a real-time view of what's going on, where are vehicles, where are buildings, and really giving the officers a tactical advantage to increase their safety and the safety of the residents and others around there as well. In search and rescue is also very fun. So, in search and rescue, we have rough terrain here, great expanses of terrain, and so the drone allows us to get up in the air, search areas that are rocky, that are rough to traverse, and allows us to cover a lot of area in a short amount of time. So the potential in law enforcement and search and rescue is phenomenal. And as we keep learning about drones and technology and their uses, I think we're going to find more and more areas in county operations, potentially in inspections as well. For example, inspecting drone towers, buildings, roofs, where there's an element of danger, we can decrease that danger, allow the drone to do the work, and give real-time information and a real perspective for staff.
Yeah, you can really see on search and rescue, for example, how beneficial that may be to have a drone, the amount of man hours you cut back on, the safety, and just being able to find what you're looking for more quickly.
Absolutely, and the Sheriff's Department has had some great successes with that. I know out towards Clay Springs they were able to find an individual that had wandered out into the woods and got disorientated, and I think that was a great success. Without ever calling out the whole search and rescue crew, within 15 or 20 minutes they were able to locate this individual, and it saved a lot of resources and time, and it just showed the capability of this. And
that's wonderful. Now, the drone that we have here, is this the one that Public Works uses?
yes.
And are you the only pilot for this drone?
I'm the only pilot in Public Works.
So even if I asked you really nicely, I still couldn't fly this drone, is that right?
You actually could.
There's some certifications you have to go through that you were talking about, is that right?
As a remote pilot, I can actually have someone else pilot the drone if I'm standing next to you, and maybe we'll have to try that afterwards.
We
Supervisor
will. We might have
be
to,
a lot of fun.
as soon as we head out of the studio here, maybe we'll go give that a shot. Well, good. Anything else you'd like to discuss on the use of drones?
I'd just like to share that I'm really excited about this. I'm excited that it was staff that did the investigation, that found the technology, that did some pilot work with it, and really started to develop it. And so I'm really proud that that staff came up with the idea, and as administration, we're able to incorporate that, find larger uses, find the right policies and guidelines to go around it. And it's fun to see that staff are excited about this technology and that we can leverage it for the community's advantage.
Yeah.
That's great. You know, the motto of the county is proudly serving, continually improving, and this is a great example of trying to continually improve. So thank you both for being here with us today. Thank you for what you bring to the team. It's been a pleasure for me to work with both of you in my time in the county, and you're a great representation of the type of team members we have at the county. So thanks so much.
You're welcome.
Stay with us. We'll be right back on Navajo County Connection. Welcome back to Navajo County Connection. I'm District 4 Supervisor Steve Williams. And we're now joined with Public Health Community Outreach Specialist Allison Hephner and Marketing and Development Officer from Summit Healthcare, Angie Fabian. We're glad to have both of you ladies here today with us.
Thank you. Very excited.
Before we discuss what you came to talk about, why don't you each give a little background? Allison, how long you've been with the county and what your role is there, and then Angie with Summit Healthcare, same thing.
Okay. Well, I've been with the county for 5 years. I started in risk management and then went into public health. And at public health, I oversee community outreach. I oversee the accreditation process, children with special health care needs, the HAPPY, which is Healthy Arizona Policy Initiative, which creates community gardens throughout all of the county. In fact, I have one in Winslow and one in the White Mountains, in Show Low White Mountain Community Garden. And that's about it. So I'm very fortunate. I get a lot of fun stuff, and I get to be out in the public, which is where I really thrive.
That's about it. You wear a number of hats and do a number of things, and you're also a mother again. You have a new baby boy, is that correct?
Baby boy. After I had 2 girls, and now I have my boy, and hopefully my girls will never see this because he's my favorite. I love him.
Well, congratulations. That's wonderful.
Thank you.
Angie, tell us.
I'm Angie Fabian. I am the Chief Marketing and Development Officer for Summit Healthcare. I've been here for 6 years. So I do all the marketing for the hospital, the physicians, all the fundraising, all the fun stuff.
That's great. Well, we're glad, Summit Healthcare is the largest employer on the mountain and a tremendous partner to Navajo County, and we're grateful to have you here with us today and for your partnership on what we're going to talk about. I'm going to have to read this because I've learned an acronym here today, or a couple of acronyms, but I'm going to say the titles themselves. So we're here to discuss the Community Health Status Assessment and the Community Health Improvement Plan. So besides these long names, tell us what these are.
Okay, so we have the CHSA and the CHIP. And what the Community Health Status Assessment is basically, to boil it down and simplify it, a census of public health issues, public health, things that are going on in the community. Like, for instance, where's our numbers in diabetes? Like, how much diabetic issues do we have in public health last year? Or should start with, the Community Health Status Assessment is done every 5 years. So once it's completed, it's basically a document of a ton of numbers that show us, okay, this many people in Navajo County have diabetes, or this many people in Navajo County, we have this many doctors. We have, this is our demographics. So it's a lot of information to where we're able to take that information and look at the priorities and say, okay, it shows here that one of the priorities that we need to focus on is health. And one priority the last 5 years was we didn't have enough people going to medical homes. Like women who are pregnant weren't going in and being treated in the beginning of maybe you can explain that a little bit better.
Women who find out they're pregnant aren't going for prenatal care. So that was a concern. And from our standpoint, we have to do a community health assessment also. So partnering with Navajo County is a win-win, because we want to know how many, we have this number of physicians like Allison was saying, but what are the needs? What are the needs for the community? And as you know, our number one need is mental health and substance abuse. It has been for a very long time. So what can we do to help improve that? And we've been working for the past 4 years since we did our health assessment on improving that.
Yeah, and one of the things when the partnership, like I would go to their health assessment meetings and then they would come to our health assessment meetings. So, and we found that we're parallel to each other on what the community status assessment identified as the issues. That's how they worked so hard and so great with the telemedicine and stuff, that because we do live in a rural community and we are lacking on special resources, especially in healthcare. Yep. So what the CHSA does is it shows us where we need to focus, and the CHIP, which is the Community Health Improvement Plan, is the strategies of how we need to get there. So telemedicine was one to address the fact that we don't have certain specialists up here. Going out and I'm trying to think of the gardens, community gardens. We have a high obesity rate. So one of the ways to address that was to create more community gardens and get more information and training out to the community. The White Mountain Community Garden does a phenomenal job at that. And because of them, we were able to create another garden in Winslow that went up in 6 months, and they're doing phenomenal. And there's been 4 gardens that have been created either with my participation and incredible people putting it together, or just people coming up and coming to White Mountain Community Garden going, wow, this is awesome, I want to create it there. So it's been, it's a snowball of awesomeness, basically, is the best way to put it.
There's wonderful people that volunteer, things like that. But so the benefit of a CHSA is obvious, because you identify what areas we need to focus on to help promote public health in the area. And then the effort that goes in my guess is the magnitude of the effort in going in to gather the information that you need. Why don't you talk about that?
Okay, well, Summit Healthcare is one of many partners that are partnering on this. So what we did is we went out and we brought a lot of people to the table that not only can provide guidance, but can provide data for this assessment. We had to go out and get someone to contract to bring in those data sets that we need, and who have MOUs and partnerships with other areas or agencies where they can get more information in our community. It's very hard to boil down data for rural communities. The previous assessment that Navajo County did was more getting information from Maricopa County, and Maricopa County assessing what we have. Luckily, with technology, things are improving, and access to data is improving a lot. So it's planning meetings. In fact, we have a planning meeting coming up in less than a month, where we will get together with these partners and we will discuss what we want out of the CHA, what we want to see out of the CHSA, what it needs to include, and then what we can offer as different agencies. You know, Summit has a lot of data that would be awesome to get our hands on. North Country has data, IHS has data, and these are some of the partners we've reached out to. We've reached out to NPC, the Economic Development for Navajo County. They're a part of this because of the demographics. The community status assessment also shows what people make in different areas. You know, they have Snowflake to Pine Top to Holbrook, what the wages are there as well. There's so much stuff that goes into this, because everything affects public health. If you don't have a job, you're affected by public health. If you're low income, you're affected by health. It affects you because you can't afford that healthcare. If you don't have insurance, if you know, people forgo healthcare all the time because it's expensive, and it's one of the most complex issues right now to try to wrap your head around. And so what public health gets to do, which is exciting, is we focus on promoting health, finding the issues, and addressing those issues so that the community is healthy, not individually healthy. Summit Healthcare does both. They get to focus on the person, and they get to partner and focus on everybody else. Correct.
And doing a community survey also to all community members will be beneficial, because that'll tell us what their needs are. What is, you know, pregnancy, prenatal care, telemedicine, psychology. What are your health needs? What do you think the health needs of the community are? And when we did our assessment a few years ago, we focused a lot on schools, because that way because teachers are front line. So they see what needs are in the community with the children. So it's all good.
So is the survey, I thought I heard you say every 5 years. Is it every 5 years they do a survey, or is it ongoing gathering of data?
Ongoing gathering of data. You're constantly updating your survey. We're not gonna resurvey next year. We're just gonna see where we are and what needs we've met so far as of outcomes to the survey.
And that's wonderful. And then we can focus on healthcare providers, and the county can focus on where do we need to improve.
Yeah.
Mental health issues, prenatal care, for
Yeah.
example.
And the
Exactly.
board of supervisors will be brought in on this, especially when our focus groups, because we do the survey and then we boil it down even more in getting community members to be involved in these focus groups, and we sit down and say, this is what the CHSA shows. What do you think? Is this correct in your mind, or are we missing something? It is it's a year process to get both of those assessments, and then you can access those on the county website, and I'm sure there'll probably be
And summits too.
And that was my next question, is the information open to the public? I imagine it is. If they want to find out more information or better understand the process, where do they go?
For us, they can go to the NavajoCounty.gov website and get it there. I've had a lot of people reach out to me through community outreach to use the assessment for a lot of nurses that are going to school, need that for their projects and finding that data to see how healthcare is impacting our community.
And ours is on our website, summithealthcare.net.
SummitHealthcare.net.
They're
Great.
both on there right now, the last ones that we each did.
Wonderful. What else? Anything else you want to touch on as we wrap up the conversation?
Well, if you're interested in being a part of this, if people out there are interested as community members or agencies and want to get involved in it, it is a partnership for 5 years with us, where we'll be updating things like Angie had said. And if they want to be a part of the focus groups or part of the planning groups there's people out there in our community that are champions. If they really want to champion for the health of the public, this is a great opportunity to come in, and this makes a difference. It really does. I told people last time with our survey, take this. If you want to see change, and you want to see change for the positive, take the survey. Get us the information that we need to make life better for everybody.
That's great. We've got to have accurate information if we're going to make improvements.
Exactly.
Absolutely.
Better quality of life. So great, wonderful. Well, Angie, thank you for being here
Thank you.
on behalf of Summit Healthcare. We appreciate that partnership and all
Thank
that that organization does.
We do too.
And Allison, thank you for what you do, and congratulations again on being a mother for the third time.
And the last.
So, and the last. Good.
Done.
And thank you to each of you for joining us on Navajo County Connection. Again, I'm District 4 Supervisor Steve Williams, and we'll see you next time.